You're listening to Mistreated. I'm Nam Kiwanuka. On last week's episode, we spoke with actress Andrea Lewis about what it's like to live with polycystic ovarian syndrome, or PCOS. It was an eye-opening conversation, but we wanted to dive even deeper into the research being done on the condition. We reached out to Dr. Kendall Soucie, an associate professor and a researcher at the Health Experiences and Longevity HEAL Lab at the University of Windsor. Her research is centered on speaking with women about their lived experiences with PCOS, not only to gain a better understanding of how the condition presents itself, but how it impacts those with it on a daily basis. Her work also explores how chronic health conditions affect you across your entire lifespan. And when it comes to funding, and you may need to sit down for this, in the United States, between 2023 to 2025, the National Institutes of Health funded over 200,000 projects at a price tag of about $124.5 billion. The amount that PCOS got, funding spread out across 19 projects, was just $7 million, or 0.009% of all funded projects. And in Canada, in that same time frame, only 11 projects related to PCOS got funding at around $1.3 million. And in percentage points, that's slightly worse than the US at 0.007%. Dr. Soucie also stresses that very little funding goes towards studying the lived experience of PCOS, so conversations around its impact on mental health and quality of life are largely ignored. And that's why her lab focuses on that. In our conversation, Dr. Soucie also dispels some myths around PCOS. Can you get pregnant? Is weight gain a sign that you have PCOS? Is there a cure? Can you reverse the symptoms of PCOS? She answers all those questions and more. While we've known about PCOS for some 90 years, Dr. Soucie says there's still so much to learn about what she says is the most common and most easily misdiagnosed hormonal disorder. She joins me now. Kendall Soucie, welcome to the podcast. Hi.
Hi, thank you for having me. I'm excited to be here.
I'm really looking forward to our conversation. Kendall, can you let everybody know what it is that you do?
Sure. So I am an associate professor at the University of Windsor, and my research interests are in understanding the lived experiences of polycystic ovary syndrome, which is the most common endocrine syndrome in women of reproductive age, but it is also highly misdiagnosed. So we try to kind of understand why we see that diagnosis delay, and what the kind of general experiences are like living with PCOS sort of day to day, what challenges folks face, and also what sort of possibilities there are in relation to just a better understanding of PCOS.
You said that PCOS is highly misdiagnosed. Why is that?
Part of it is historically there have been a lot of different diagnosis criteria with respect to PCOS. So folks were using just different criteria across the board. So prevalence rates are sort of, all over the place. There's also heterogeneity in terms of symptom presentation. So at this point in the literature, there's 4 phenotypes of PCOS. So it presents sort of differently in folks. PCOS is also kind of a misleading name, right? It's PCOS is a multi-system condition, but the focus has really been on kind of the ovary and the gynecological aspects of PCOS, but it's much broader than that. And so I think that's sort of part of it, the kind of misleading name. PCOS is also underfunded, under-researched, has been really neglected for a really long period of time. So we're only now learning about, the multiple impacts of PCOS really, over the lifespan. So I think that those are some reasons why, including really a lack of awareness and understanding and education about PCOS too.
Kendall, some experts say PCOS, quote, looks to be at least 2 or 3 different conditions that have been just kind of like lumped together, and there are calls for it to be separated into 2 different diagnoses. Others say the name polycystic ovarian syndrome is misleading and that the name should be changed. There's also an argument made by an Australian researcher that PCOS, quote, causes heart disease, it causes diabetes, it causes mental health issues, but it cannot be funded by mental health grants or heart disease grants or diabetes grants because polycystic ovarian syndrome is stuck in the gynecology and women's health bucket. The argument being that PCOS is not just a gynecological condition. Kendall, can you help us to understand why that is?
Yeah, I think that's the message that we've been really pushing, and a lot of folks have been pushing, is that PCOS is really more than just a gynecological issue. You touched on some of the comorbidities with respect to PCOS, but there are reproductive impacts, there are metabolic impacts, like you talked about, type 2 diabetes, insulin resistance. There are mental health impacts. The funding is disproportionately connected to grants that have something to do with really restoring fertility. So that's kind of been the focus. So there's been a movement around really changing the name so that it includes more of that holistic kind of multi-organ, multi-system kind of syndrome. And like there's some folks that are really strongly for changing the name. There's some names that have been proposed. There's a conversation that's kind of starting around just, encapsulating really kind of that multi-system perspective with PCOS, so that folks aren't just, talking about the ovary, and they're talking about other kind of impacts of PCOS. However, there's advocacy groups that have really based, their entire platform around the name, right? So around PCOS. And there's a ton of advocacy work, in the PCOS community spaces, really internationally. So I think now we're finally getting movement and recognition of PCOS and what it means and what the comorbidities are and what the long-term impacts are. So it's a tricky conversation to change the name when finally, finally we're getting some of that recognition. So is now the time? Again, there's folks for and against it. And there was recently a survey that was sort of sent out to capture, participants, caregivers, healthcare providers, researchers' perspectives. And folks were quite favorable with respect to changing the name. But I think we need to think through it, work together as a multidisciplinary sort of team. And with folks with lived experience to really ensure that we're doing this sort of thoughtfully, and with those perspectives in mind too.
I imagine some of the trepidation around changing the name is that now you do have the momentum. People are talking about it. As someone who's a researcher in this space and as somebody who has PCOS, why is it important to center those with lived experience?
I think it's incredibly important to really kind of amplify and like you were saying, center folks with lived experience with PCOS, because so much of PCOS care is really siloed and fragmented, is what we've sort of learned, and really kind of devoid of patient experiences. And so lived experiences give us opportunity to understand how the syndrome is impacting our lives kind of day to day, how treatments are kind of impacting our own kind of, trying to think of the right word, like our own like future risk of various comorbidities. So I think the lived experience piece and the work that we focus on is more like storytelling based. So we want to hear about folks, their kind of diagnosis journeys and their lived experiences really over their life course. And we've learned so much from those experiences, not only from folks who live with PCOS, but also caregivers as well. Like family members, friends, peers, right? Like those relationships have been really helpful in informing really what it's like to live with PCOS, but also the next stage of research priorities with respect to PCOS too. So what is it that patients want? What is it that, we need? What is it that we're striving for? What are our goals? Because those goals and those perspectives might be different, in important and nuanced ways than goals that, professionals or various stakeholders have with respect to our care.
Do we know what causes PCOS?
So we don't. That's the tricky part. We don't know what causes PCOS. There's some theories that have been speculated. For example, there's a high comorbidity among relatives with PCOS. So if you have a first degree relative with PCOS, you're also more likely to have PCOS. There's also conversations around inflammation, like inflammatory markers, around like lifestyle, endocrine related issues or endocrine disruptors, just in relation to some of the environmental exposures we are being exposed to. So, but it's likely epigenetic, in nature. So a combination of both a genetic risk or genetic propensity and lifestyle factors and stressors that we're sort of exposed to, you know, in modern life.
Is there a cure?
There is not a cure now. Actually, since PCOS has been kind of identified nearly 90 years ago, it was first identified by this sort of seminal paper by Stein and Leventhal in 1935. And in that time period, I mean, we're in 2025 now, we have no idea really what causes PCOS. And there is still, like, over 90 years later, no cure. And there's a hodgepodge of treatments, but
That was going to be my next question because my understanding is that there is no one medication to treat PCOS.
Yeah, so there's several medications that can be used to manage symptoms associated with PCOS, which folks will say that it's more of like a Band-Aid kind of solution. So, for example, birth control is the first line of treatment in PCOS care, which a lot of folks are, concerned about. There's also medication called metformin, which is an insulin sensitizer, which helps with insulin resistance. There's some anti-androgen medications. There's some other treatments around fertility. So you're kind of just treating symptoms, and you're not really treating like the underlying kind of causal or mechanistic issue.
You spoke a little bit about fertility. Can you get pregnant if you have PCOS?
Yes. Yeah. I think that's one of the biggest misconceptions is that, fertility, and that's the focus of research for a long time too. But yeah, you can get pregnant with PCOS. And there's a lot of folks like reproductive endocrinologists and OBGYNs who specialize in PCOS that can, have those conversations with you, but it is 100% possible.
But we should also mention that for some people with PCOS, becoming pregnant might not always be the goal.
Yes, exactly.
Why is it important to mention that?
Yeah, I think it's important because it may not be, like you said, it may not be the goal. A lot of folks talk about, other issues that they're concerned about with respect to PCOS. It may be fertility. It may be the cardiometabolic risk factors of PCOS. So there's concern about, heart disease or stroke. There's concern about cancer, like there's a risk of endometrial cancer in folks with PCOS. So, pregnancy may or may not be your goal. But I think having a more of a integrative, like holistic perspective with PCOS, because typically folks present with multiple concerns. It's not always fertility. Also, the one other interesting thing with PCOS is folks tend to be diagnosed when they are trying to get pregnant. So that's kind of the other piece that's sort of interesting, is when fertility may be a concern or maybe at stake.
Mhm.
That's when the referrals and that kind of thing come in.
How early can PCOS show up, though?
It shows up pretty early, typically in adolescence, which is why it's sort of challenging in terms of the diagnosis, is because there's a lot of conversations around like what does normal puberty, look like, and how long does it take for bodies to kind of get to that point where there's sort of those abnormalities, right? So typically, like in a lot of the data that we collect, you're 13, 14, 15 years of age, and you sort of know that. The symptoms you're experiencing don't feel sort of normal for your age, or they feel sort of inconsistent or different from your peers, for example. So it shows up really kind of in adolescence, but folks tend to experience really lengthy diagnosis delay. So
Mm.
our data really, supports the fact that, folks are going to their physicians when they're in adolescence and are not necessarily receiving that diagnosis until 5, 10, 15 years later.
I want to stay on this a little bit because, when you become a certain age, you're anticipating getting your period. And when you don't get your period, maybe you encounter conversations. Well, yours is just coming later. You're lucky. It's going to come maybe when you're 16, 17, 18. Why should parents pay attention to that?
Yeah, I think it's important to have those conversations. I think just, literacy, like health literacy around menstruation, around what's normal, what's not normal, because that's the response you typically get, right? Like you typically get the kind of, well, you're young, it'll work out, and these symptoms are normal for your age. It's just like puberty. Maybe come back in a few years, or even when you're a bit older, you'll get the kind of come back when you want to have kids. Why worry about it now, right? Those kind of things, and some of the data that we've collected around like early experiences of PCOS have really pointed to the importance of like mother-daughter conversations and just conversations in general around PCOS, and sort of highlighting the fact that having pain, for example, or irregular periods, like not having a period for a very long period of time, is really not normal. And some of the other sort of symptoms associated with PCOS, are also not normal. So having, I think, just challenging the stigma, right, and having conversations about periods and about, like mood issues and those kinds of things are really important, so that young people can really start to have those, conversations with others too. It just sets the stage for, again, these like fruitful and productive conversations about health that we just historically really weren't having.
I think some people might be surprised to hear that in 2025 there is still stigma around talking about periods.
Mm.
But Andrea Lewis, who we spoke to last week, and she told us her PCOS journey, said that when she first, she never had these conversations when she was younger, and when she did get diagnosed with PCOS, she didn't really take it seriously because. I guess the way it was presented to her was like, well, as long as you're not trying to get pregnant, you should be okay. How does that impact people with PCOS when their symptoms are kind of played down?
It's frustrating and it's disappointing and it can be exhausting, especially if you've been going to multiple doctors and you're like kind of clinic hopping and trying to kind of get an answer for what's going on in your body. So that's part of it, is sort of like the mental health toll and the kind of burnout and exhaustion around that. But also, we've learned too that, those experiences really kind of hinder folks from wanting to go back, for even preventative stuff. So it creates this kind of distrust in a way with the medical system, especially if you've seen multiple providers and aren't getting anywhere. And so you sort of think to yourself, well, I'm just going to go to another, physician who's just going to dismiss me again. And maybe it is all in my head. And maybe there isn't anything wrong with me. And then you just sort of stop going and you sort of just try to live your life and manage what you can manage in that moment. But typically with PCOS, it doesn't really, get better sometimes, right? Like sometimes you do need medication or sometimes you do need that extra support. And so that alienation from the medical community is really profound for folks with PCOS.
There is a perception that when you have PCOS, you have trouble losing weight. Andrew Lewis told us that PCOS is sometimes called a lazy girl's diagnosis, implying that if you have PCOS and can't lose weight, you're just being lazy. First, so insulting. And secondly, is weight an indication that you have PCOS?
So, the weight gain associated with PCOS is the result of insulin resistance. So, it's like our bodies are almost like working 10 times harder than folks who don't have insulin resistance. So it's not your fault. And the shame and blame around weight is one of the intersections that we explore in our work. And it's really discouraging and really frustrating. And that point about the sort of lazy girl thing, right? Like we challenge that quite a bit. Um, I understand that. But also with PCOS, there's actually a phenotype called lean PCOS that is highly misdiagnosed, because there are women who have PCOS and have some of the symptoms of PCOS but are underweight. So you kind of end up in this sort of situation where a lot of folks think that weight is a central feature of PCOS, and for some it might be, for some it might not be, and that's why it's so hard to diagnose sometimes, is because so many folks present so differently, with PCOS. So weight may or may not be a factor. And that's why we need, more folks kind of doing research in this space really to understand, these issues, right? Like we focus in our work on, like I said, weight stigma, and obesity stigma, and how that relates to delayed diagnosis and those kinds of things, because physicians sometimes will focus on just the weight loss. Like we've had participants say that, oh, well, this physician won't see me or treat me until I lose 5 to 10% of my body weight, kind of thing, right? And so it's incredibly frustrating. And you know, incredibly unhelpful.
We almost call this podcast "Just Lose 5 Pounds" because it seems to be the solution for every issue that a woman experiences. Oh, just lose 5 pounds and you'll be fine. You, in the absence of, we were talking a little bit like when you do go to your doctor and your doctor dismisses you or you don't feel heard. Um, Inevitably, what happens is people end up online, and online there's a lot of great information. I will say for firsthand with my fibroid experience, I found that's where I found the information that my doctor couldn't give me. But for PCOS, it just seems to be like the wild, wild west. A video that I recently saw has over 500K views. And this person is saying that you can reverse your PCOS symptoms depending on lifestyle changes. Is that true? Can you reverse PCOS symptoms?
I wouldn't say that you can reverse PCOS symptoms per se. I wouldn't say that you can cure PCOS. I'm hearing a lot of discourse around like, PCOS can be cured. You can manage symptoms. It's all about symptom management. It's all about, partnerships with healthcare providers. It's all about trust and finding the right provider who will go down that route with you, and provide, accurate evidence-based information. So I think the social media platforms are helpful because when you do feel disconnected and alienated from the medical community, you do Google and you do turn to online spaces. And there are some spaces that are great that are vetted by medical professionals. So Monash University has an entire kind of platform website that has a ton of evidence-based information for both like providers and also for patients. So like infographics, accessible information. But there are some, I don't want to call it like influencers, for example, but there are some folks that really do kind of perpetuate misinformation about PCOS. There's some websites that aren't up to date, that aren't, vetted. And then that really perpetuates the myths and misconceptions about PCOS. We found in our data that some folks, feel sort of empowered and validated when they do, go to these spaces because they learn, tips to advocate. They learn about, different things to ask their doctors or medications to ask for, and they sort of enter into the medical space quite informed. But then other folks feel almost defeated from, being in these communities, and they might feel like, oh, well, maybe my PCOS isn't worse enough, or isn't bad enough, or maybe I'm not doing the right thing, and then they unfollow. So it's sort of like, buyer beware kind of situation. Like you want to make sure you're consulting spaces that really are, evidence based and really are kind of managed and regularly updated and checked with folks, in medicine. To make sure. And there's actually a great one, like Monash University I mentioned, but also in Canada, there's PCOS Together, which is a group out of Alberta that has a lot of information about PCOS. There's also PCOS Challenge, which is incredible. And they are an international group that has over 60,000, like, members that are patients, providers, caregivers, various stakeholders. And then there's a new group that just popped up that is phenomenal called the Seasons Collective. And they are in Toronto. And they have, they're sort of a newer kind of community with that goal of introducing folks to providers and researchers and just building really a community to focus on legislative advocacy in Canada, because Canadians have been really underrepresented in PCOS care. There's not really many spaces for us to sort of connect and build community together. And the Seasons Collective and PCOS Challenge are, in Alberta as well, like are really helping with those platforms and those movements.
We'll share those resources in the show notes. Kendall, last week when we spoke to Andrea Lewis, she mentioned that one of her physicians had recommended that she use Ozempic. She said that she actually ended up gaining weight from using Ozempic. We're hearing conversations around Ozempic maybe being a medication for PCOS. Is that true?
Yeah, there's a lot of conversation now, a lot of discussions around Ozempic as a potential treatment for PCOS. And I think, it's still kind of like a newer area like of interest. And so, but I think it really goes back to like having a conversation, doing your own research to understand if this is a right approach for you. And that partnership with your provider, I think, is crucial to that, right? And I think having a provider who's up to date on new treatments that are coming out with respect to PCOS is also really helpful. Ozempic is being, again, talked about quite a bit, but it really, depends on you. It depends on your needs. It depends on all other, a lot of other factors as well with respect to PCOS. But I appreciate you bringing that up because it is, something that's being really talked about and researched in the medical space with respect to PCOS too.
How much funding
Mhm.
goes into studying PCOS in Canada, I guess, compared to other jurisdictions?
Not much, to be honest. I did a deep dive at one point. So in terms of the funding, really, there's sort of the Canadian Institute for Health Research. There's the Social Sciences and Humanities Council of Canada, CIHR. The first one I mentioned funds more like biomedical stuff around PCOS. And a few years ago, I did sort of a deep dive into the funding kind of stuff with PCOS. And it's sort of women's health is generally underfunded, but with respect to PCOS, less than 0.1% of the research um, is devoted within the women's health space to PCOS.
Sorry, can you say
That's
that number again? Can you say that?
yeah, that's okay. Yeah, less than 0.1%. So a very small proportion of funding within the women's health space goes to PCOS, and of that funding, of that like less than 0.1%, the majority of that is devoted to reproduction, right? Like understanding follicular development. So the development of the follicles, right? Like, and very few studies are looking at the cardiometabolic impacts of PCOS, and even fewer studies are looking at the mental health impacts of PCOS. So we've been fortunate to have had funding, some funding from the Social Sciences and Humanities Research Council to understand the lived experiences of PCOS as really kind of a gendered, full body, all encompassing sort of syndrome. And we've collected a lot of interview data. I'm the director of the HEAL Lab, so it's the Health Experiences and Longevity Lab. So we're a team of women and gender diverse folks who are like really like trying to elevate, the profile of PCOS in Canada. But it's still a battle. It's still an uphill battle. It remains severely, severely underfunded, given the prevalence rates of say 1 in 8 folks with ovaries have PCOS, and also with the fact that there are so many comorbidities and 70% of us remain misdiagnosed. So we need folks to invest and come together to fund this work so we can understand this misunderstood condition better.
I had you repeat that number because it's like a percentage of a percentage point, which is just kind of like, what? You've said that the literature on PCOS is bleak. One was about how PCOS steals your femininity. How does that impact what is studied when it comes to PCOS?
Yeah, it's interesting because when I first started looking into PCOS, I started reading research articles and peer reviewed articles. Just, I wondered what we knew about PCOS, and what I read was so biomedical. Like I was like sifting through just so much like endocrinology and like trying to understand it. And I was like, okay, well, where's the social science perspective? Like people live with PCOS, right?
Mm.
Like where's that perspective? And I looked into the social science literature. Some of it was in nursing, some of it was in psychology, but very, very little. It's like a tiny little robust, body of literature, but quite small. And it was incredibly negative and incredibly deficit based. So the titles of some of the studies, and they were great studies, right? One was that PCOS was a thief to womanhood. One study was, it's not feminine to have a mustache. Another study I remember was I drew the parts of my body in proportion to how much PCOS ruined them. Again, they're phenomenal studies and really show the kind of negative impact of PCOS. But I thought to myself, and meeting with my lab, and my students had the same thought. They're like, well, there's got to be a counter narrative. There's got to be
Mm.
another side to the story where folks with PCOS sort of thrive and they cope and they build community and they heal and they come together. Like, what does that side of the story look like, right? So we wanted to infuse a more strength-based approach to understanding PCOS that's really in opposition to this sort of like decades of deficit based research that's out there. And that's what we've been really trying to do. So we look at constructs like self-compassion. We look at, social support. We look at gratitude. We look at, like advocacy and community as a way to really, I think, push the field in a direction that is a bit more positive,
Mm.
you know?
You mentioned the
Mhm.
work that you do at HEAL Lab at the University of Windsor. I mentioned you have PCOS. How has researching it helped you understand it better personally?
I love that question.
Mm.
Because, just I think we've collected over hundreds of narratives and stories and experiences of women from PCOS. that just like fuel me, like they nourish me in ways that I can't fully explain. I mean, I sort of feel part of a larger community of folks who are just, fighting the fight and advocating and having conversations with people in their circle. And some of them are, even having conversations at bigger advocacy events. I've learned about health literacy. I've learned about just from interdisciplinary conversations too, about biomarkers. I've learned about different facets of PCOS that I feel strongly about and connected to. I mean, we started this sort of body of work around the strength-based perspectives from several interviews where folks were really kind of talking about and highlighting just body compassion and how much they love who they are and how they wouldn't change anything, that they've become stronger from this diagnosis. And I feel the same way. I feel like I always said when I was getting my PhD in grad school that I wanted to use my PhD to do good things in the world, and like that I wanted to, and I feel like, that's what I've been trying to do. And I've been trying to really, start this conversation and help contribute to this movement and just, I guess bearing witness to these experiences that I feel so privileged to have heard from so many women over, many places in Canada, like many regions and of many ages and diverse backgrounds. I'm just sort of, you know, completely and utterly like just in awe of these experiences. And I think it shaped me as, for the better in terms of a researcher, but also as a teacher too, right? So I'm helping to, spread awareness and educate really the next generation of folks who might be going through this diagnosis. And I feel like honored to be able to do that and have
Um,
these conversations.
you used a word earlier, biomedical, which I guess it's just like
Mm.
it's just focusing on, I guess, the clinical part of it and not including the people part of it. Do you think it makes a difference if a researcher has that lived experience of a condition when they're studying it?
I do. I think, it's interesting because I never really used to say that I had PCOS. Like when folks would ask me, like, why are you studying PCOS? Oh, I'm just sort of interested. Like I had a hard time, I think, grappling with that identity as both like a patient and a researcher. But I think that there's a sense of trust. There's a sense of, camaraderie and connection when you occupy both of those identities. When I'm somebody who's a PCOS patient and we're interviewing folks with PCOS, I understand, right? I understand what they're going through. I've lived it. I've lived parts of it, probably, and I sort of understand that frustration with the medical system, the frustration with your body. I understand all of those pieces, and I think also listening to folks and listening to their stories. Has really shaped the direction that I want to go in terms of my research, because I want to make sure that I'm constantly honoring the perspectives and the needs of this population. So it works kind of both ways, right? Like I've learned so much about myself, and I've learned about what folks want and what folks need, and I'm really ensuring that we're prioritizing those lived experiences. And anytime I have the opportunity to talk about PCOS or go to an event or just be present, like, in the moment with somebody, it's just incredibly fulfilling and incredibly rewarding.
I think the journey from finding out that you have something that your own doctor might not fully understand, and then trying to figure out how you are going to live with that condition that doesn't have a cure and you're dismissed. When it comes to PCOS, what are the shortcomings of the healthcare system?
Yeah, I mean, I think a lot of it has to do with just really, we talk about the lack of awareness and lack of education with respect to PCOS and just multiple diagnosis criteria. I mean, used by very different providers. So I think like there's a lot of those systemic issues around just training and education of PCOS, and that's why Monash University, some leading experts in PCOS care, put together this international evidence-based guideline for the assessment and management of PCOS that basically is this consolidated, guideline that everybody should use. So I think it helped with that. There's, continuing education credits for folks to learn more about PCOS. I think that's part of it. I think, there's this sort of, I don't know, disconnect sometimes among like just conversations among just different care teams as well. So women feel like suspended and bounced around. We've had, patients kind of talk about how, their general practitioner diagnosed them with PCOS and they were referred to, endo or OBGYN we're not diagnosed with PCOS. And they're like, what am I supposed to do? And they're bouncing in between, or, there's just not really even post-diagnosis information. So if you get a diagnosis of PCOS, you're kind of just like, oh, okay, well, what's next? And right. And so we need to have more of those, multidisciplinary conversations with each other. There's this push toward, patient-centered care, kind of more holistic care. I think it's also challenging too, because physicians have such little time, with patients as well. Like we understand the systemic barriers that are out there too, right? You have a very short amount of time. So we talk about ways in which women and folks with PCOS can sort of prepare for appointments. And there's resources online, like question prompt lists that, have some examples of questions that you can ask to make sure that the short amount of time you have is really directed toward you. And there's, some conversations around sharing, provider information, like who are the providers in Canada who focus on and support patients with PCOS? Where can we find that information? We've found in our data, nurse practitioners are a phenomenal first line of defense with PCOS, and you can book a longer consultation. So the intake process and gathering that history is a little bit longer with nurse practitioners. We talk about other forms of kind of advocacy as well that sort of help, but it's a larger systemic issue that really I think folks are working on, building those partnerships and trying to figure out how to improve care, because it's, really getting a quicker diagnosis leads to a quicker plan, right, for your life, right? Like I always say, if I was diagnosed earlier, it took me 5 or 6 years to get a diagnosis. And at the time, my blood work was like a complete disaster. And I think if I was diagnosed much earlier, and a lot of our participants say the same thing, they would have made different changes and different, taken it kind of different pathways in some ways, got support earlier to sort of prevent some of the elevated risks that they see now, right? Like things like type 2 diabetes, things like heart disease, things like endometrial cancer. So early intervention is so important, which is why the delays are so challenging in diagnosis of PCOS.
Thank you for sharing that about nurse practitioners, because I think there's an understanding that it's gynecologists who we have to see, but with the wait
Mm-hmm.
lists, it's good to know that information. And 5 to 6 years to get a diagnosis. I'm so sorry,
Mhm.
because it's like all those years
Thank you.
are gone, right? Kendall, really learned a lot from this conversation. Enjoyed my
Thank
time
you.
with you. Is there anything that you'd like to add that I haven't asked?
No, I think we covered a lot of ground, actually. I think we captured a lot of aspects of PCOS, and I would just encourage folks to connect with us if they have any questions. Can leave my contact information. We're always happy to just connect with folks and have more conversations and raise more awareness around PCOS. So thanks for this opportunity to have me and for this entire conversation. It's awesome.
Thank you, Kendall.
Thank you.
This was Mistreated for November 4th. You can follow our show on Apple Podcasts so that you can get notified each time a new episode is available. We would love to hear your feedback. You can write me an email at mistreatedpodcast@tvo.org or reach out to me on my social channels. We'd love to hear your stories, and you can send us a voice memo if you'd like to share your story on the podcast. Here's some feedback we got on YouTube from our episode on PCOS. I know the feeling of being dismissed by a doctor, especially when it comes to talking about health matters like PCOS or menopause. It made me feel that I need to learn as much as I can on these matters, because who else is going to advocate for me when I don't even know what's going on? I hope women's health, especially in marginalized and racialized communities, will get the funding and be studied more expansively. I really appreciate the interview, Andrea Lewis. Thank you. And thank you for that comment. This week's episode was produced by Matthew O'Mara and me, and edited by Colin Kish, camera work by Max Stussy, digital shorts by Ariana Longley. Production support from Jonathan Hallowell and TVO's Digital Media Services team. Lori Few is the executive producer of Digital. John Ferry is vice president, programming and content. Thanks so much for listening.